Hello, I'm Jean Meserve. During the pandemic, we were advised to stay away from hospitals and doctors' offices as much as possible unless we were suffering from COVID-19. For many of us, telemedicine and other forms of digital healthcare were a blessing. They allowed us to continue to communicate with our healthcare providers. So what did we learn from this? Here to discuss is Dr. Jay Schnitzer. He is Chief Technology and Medical Officer at MITRE. Dr. Schnitzer, thanks so much for joining us today.
Thank you, Jean. Great to be with you.
So from your perspective, what were the big takeaways from our experiment with digital health during the pandemic?
So although we've known about the challenges for digital health for many years, COVID-19 served as a wake-up call about just how vulnerable we are as a country, as a globe, in fact, to rapidly spreading disease. COVID-19 has been both a catalyst and an accelerant, particularly for telehealth. The pandemic opened our eyes to broad health disparities across the nation. It also has underscored the glaring need for a national digital health strategy. It has amplified that need and identified, illuminated, and magnified the gaps between here and where we need to be. It is our responsibility now to make sure that the lessons learned over the past year prepare us for the next global health emergency and improve the health and well-being of all Americans every day.
Now that the imperative to use these digital tools has passed, do you worry that the momentum in this area will be lost?
Not at all. I think we've seen, just by what we've seen over the past year and a half, how valuable these tools are and how much they help, particularly telehealth, particularly for things such as mental health. And yes, we'll see some ebb and flow of that over the coming months and years, but telehealth, digital health, they're here to stay, and they are making a difference.
You mentioned a national digital strategy for healthcare. What would that look like?
Well, we actually put that together over the past several months in conjunction with our MITRE Health Advisory Council, and identified 6 goals that need to be part of the strategy. They include access to universal broadband for everyone, a workforce that is tech savvy for healthcare delivery, digital technologies that work for the individual, different types of architectures and standards that can be used to create interoperability across the spectrum, an ecosystem that supports public health, and last and most important in many ways, the governance of all of this for the system to work.
So if this national strategy were put in place, what advances do you think we'll see, short term and also in the longer term?
Well, in the near term, and by that I mean within a year or two at most, I think we should see some very quick wins that are going to matter. First of all, I think we are going to reach, or we could reach, ubiquitous, secure telehealth access and utilization for everyone. We could obtain appropriate levels of sustained, reliable reimbursement for telehealth, which would be the gasoline for the engine and keep us going. And equally importantly, we hope to reach a state in which our federal government assumes the leadership role in this complex ecosystem and engages effectively with all components and stakeholders for telehealth and for digital health going forward. In the longer term, up to 5 years or more perhaps, we hope to see a transformed health ecosystem that leverages these digital technologies that improve health and well-being for everyone. We would expect to see broadband access for everybody. We would expect to reach a state where information that is needed is available at the right time, in the right form, to the right people, wherever and whenever needed, securely, simultaneously preserving privacy, and with the access controlled by the individual patient. Next, we would hope that we'd have a tech-savvy workforce, and finally, and most importantly, it would lead to improved health for everyone.
So expand capacity, improve health outcomes, reduce costs too, potentially?
Should be. I mean, we've seen in many other industries where digital technologies ultimately lead to reduced costs. We haven't seen it yet in healthcare. In a contrary fashion, usually bringing digital technologies to health increases costs, but in the long run, we should see that with health as well as in other areas. So yes.
And we have to leave it there. Dr. Jay Schnitzer, thanks so much for joining us, Chief Technology and Medical Officer at MITRE. I'm Jean Reserve. Now back to the Washington Post.